Okay, so the topic for this lecture is infection and its control. So these are the lecture outlines. At the end of the lecture, you should be able to define the terms related to infections, the different terminologies in infection, differentiate between infectious and communicable diseases, describe control measures for infectious and communicable diseases, explain the role of immunoprophylaxis in screening and control of infection. So, what is infection? Infection is entry, development, multiplication of infectious agent in the body. And how does the body react to it? The body responds to defend itself against invader. So the infection develops in the body. There are several levels of infection: subclinical infection, latent infection, clinical infection. So, what are the different terminologies that we need to know before we uh, before we really know what is infection and what are the different associated factors? So, contamination. Contamination is presence of infectious agent on body surface or on clothes, beddings, toys, surgical instruments, inanimate articles. Infestation. Infestation is the development and reproduction of arthropods on surface of body or on clothing. So infestation is the reproduction of arthropods on surface of body. This can be exemplified by the scabies that lives in the burrows in our feet and in our skin. So it can be called as scabies infestation. Also used to describe invasion of blood by parasitic organisms. Host. So who is host? Host is the person or animal that provides lodgement to infectious agent under natural conditions. Host is the one in which pathogen attains its maturity or passes its sexual state. Uh, Definitive stage. Those in which parasite attain its larval or asexual state are called secondary intermediate host. Transport host carrier, in which organism remains alive but does not go under development. For example, the Plasmodium parasite is transmitted through Anopheles mosquitoes. Uh, the dengue virus is transmitted by Aedes aegypti mosquitoes. So those are carriers. So what is infection disease? Clinical manifestation of disease resulting from an infection. What is contagious disease? Disease that is transmitted through contact. What is communicable disease? Illness due to specific agent products are capable of being directly or indirectly transmitted from man, man to animal, or from environment. So these are the terminologies which you should be able to know. So what is epidemic? Epidemic is unusual occurrence in community or region of a specific health-related behavior or health-related events. What is outbreak? It is basically a kind of epidemic, but it is a small localized epidemic in interest of minimizing public harm, unless the number of cases is very large. Endemic refers to constant disease or infectious agent in given population group without importation from outside. It may refer to expected frequency of disease within such area. For example, we know that malnutrition is endemic in Thar, but malnutrition is not an infectious disease. For example, we know that there are certain number of hepatitis, cholera cases in a particular area. But if the cases get increased more than normal, then that would be classified as epidemic. And what is pandemic? Pandemic is an epidemic which is affecting a large portion of population occurring over a wide geographic area, such as section of nation, entire nation, continent, or the whole world, like COVID pandemic. Then sporadic. Sporadic are cases that occur irregularly, haphazardly from time to time, and generally infrequently. Cases are few and separated widely in time space, that they show little or no connection with each other for recognizable common source of infection. Sporadic diseases may be starting point of an epidemic. Then what is epizootic? Epizootic is outbreak of disease in animal population. Then very important term is zoonotic infection. What is zoonotic infection? Infections are diseases that are transmissible under natural conditions from vertebrate animals to man. For example, rabies, plague, bovine TB, anthrax, brucellosis, salmonellosis, endemic typhus. In recent affairs, several new zoonoses have emerged, for example, monkeypox. Then zoonosis can be divided into anthropozoonosis which is infection that are transmitted to men from vertebrate animals, for example, rabies or zooanthroponosis, that are diseases and or infections that are transmitted from men to vertebrate animals, for example, human tuberculosis in cattle, and amphizonosis, that is infection maintained in both vertebrate animals and men that can move in either direction. Then exotic diseases which are imported in a country otherwise do not occur. For example, rabies in UK has been eradicated, but if it is transmitted from a country like Pakistan or India, then it will be called an exotic disease. Then nosocomial infections. Nosocomial infections are infections that originate in patient while he is in hospital. So it denotes a new disorder unrelated to patient's primary condition. For example, the patient is admitted for treatment of typhoid, but meanwhile during admission he develops nosocomial pneumonia, which is pneumonia caused by certain pathogenic bacteria that are present in hospital environment. So that would be nosocomial infection. So the patient initially had typhoid, but during the course of his stay in hospital, he developed pneumonia. Then we have another terminology, opportunistic infection, which are infections that occur more often or more severe in patients with weakened immune system than in people with healthy immune system. So in HIV, in which the normal immunity of person is weakened or destroyed due to destruction of CD4 cells. There are certain diseases that develop due to low immunity. For example, Kaposi sarcoma uh, or cytomegalovirus infection. So these diseases do not occur in normal patients, but in people with low immunity, they can affect. Another example of opportunistic would be mucormycosis, which is a fungal infection which develops in persons who have diabetic ketoacidosis, and this is a life-threatening infection, and it is responsible for high mortality in diabetic ketoacidosis patients. Then we have iatrogenic diseases. Any adverse or consequence of preventive, diagnostic, or therapeutic regimen that causes impairment, handicap, disability, or death. So this is a disease which is due to, so for example, if a patient has disease and he goes to hospital for treatment of that disease, but during the treatment, inadvertently the healthcare provider damaged, or the patient the patient sustained some injury due to inadvertent procedure, that would be iatrogenic diseases. It may be serious enough to prolong hospital stay. It can be related to drug therapy, immunization, diagnostic procedures. For example, if a person is undergoing laparotomy and his spleen gets damaged, that would be called an iatrogenic damage. Also, the reaction to penicillin in the hypersensitivity reaction, the aplastic anemia, which is due to chloramphenicol. And for example, if a person is anemic and he goes to hospital for blood transfusion, but the blood is unscreened and he develops hepatitis B, that would be characterized as iatrogenic disease. Another would be childhood leukemia due to prenatal exposure to radiation. Then communicable diseases. It is transmitted from source of infection to susceptible individual, and it is dependent upon infectious agent, portal of entry, and local ecological conditions. And mostly an infectious agent is transmitted by route, not by one route, but by some are transmitted by one route, but others are transmitted by several routes. So next we will study what are the dynamics of disease transmission. The dynamics of disease transmission include susceptible host, pathogen, reservoir, portal of exit, mode of transmission, and portal of entry. So first of all, the host that is susceptible includes elderly people who have low immunity, infants also due to inadequate development of immune system, their immunity is low, immunocompromised. The persons who are who have undergone transplant procedures and being provided immunosuppressants. So those people are susceptible host. Then pathogen. Pathogen can be bacteria, virus, fungi, parasites. Then reservoir. Reservoir can be people, animals, soil, food, or water. Reservoir is a place in which the pathogen thrives and survives before eventually infecting a person. So the portal of exit is the route through which the disease exits the human body. For example, coughing, sneezing, feces. So these provides pathogen to transmit to another person. The mode of transmission is the next component of dynamics of disease transmission, which includes direct contact, indirect contact, and vectors. This we'll study in next few slides. And then portal of entry. This is the route through which the pathogen enters in the human body. It can be from mouth, nose, eyes, and cuts and skin. So another terminology include cases and carrier. The cases may be the primary case, the first case of infectious disease introduced into the population. So primary case is the first case of that particular disease. Index case. What is index case? Index case is the first case that has come to attention of investigators. So primary case is not necessarily the index case. The primary case has infected a lot of persons before it finally comes under attention of the concerned person. Secondary cases are the cases that develop from primary cases. Then cases may be also due to spectrum of diseases. It may be mild, severe, depending upon the gradient or involvement. What are the subclinical cases? Subclinical cases are those cases that are mildly infected that does not alert the patient. So the the person is infected, but there are no apparent clinical signs or symptoms. So it is hard to detect the disease in that patient. Latent cases are asymptomatic infection capable of showing symptoms under circumstances. For example, latent TB, which is the TB that is present in healthcare providers, in which if we do tests like tuberculin skin test, Mantoux test, it would come it would not come out, only it would come out positive when the person is immunocompromised. And we do the chest X-ray of the patient, we would not see the findings that are normally reported in typical tuberculosis patients. So that would be latent case. Then carriers. Carriers are infected persons that harbor a specific infectious agent in absence of visible clinical disease. And it serves as potential source of infection to others. Carriers are less infectious than cases. They live a normal life but can infect other individuals. They are more dangerous as they escape recognition. It may be classified into incubatory carrier, which are persons capable of transporting an infectious agent during incubation period. Convalescent carriers, person who continue to shed the disease agent during the period of convalescence. For example, whooping cough. Whooping cough, when the person is recovering, the patient may transmit the pathogen to other people. Then healthy carrier who emerge from subclinical cases, but in which the disease has not been completely eradicated. For example, in typhoid, which colonizes gallbladder of a person, the person needs to be given appropriate antibiotics. And if the disease is resistant to antibiotics, then the gallbladder needs to be removed. Then carriers can also be defined into temporary or chronic carriers. Temporary carriers are those who shed infectious agent for short period of time. All the three incubatory, convalescent, and healthy are included. Chronic carriers are those who excrete the infectious agent for indefinite period. For example, typhoid, hepatitis B, dysentery, malaria. Then there are two modes of transmission: direct transmission and indirect transmission. Direct transmission can be direct contact. For example, sexual contact, and direct transmission also includes droplet infection. For example, the TB and COVID virus are transmitted through respiratory air droplets. Then contact with soil. The earthworm is transmitted through contact with soil. Then inoculation with skin. For example, a rabid dog bites, then the rabies virus is inoculated in the skin. Then transplacental or vertical transmission, which is transmitted from mother to their babies during prenatal during pregnancy. Then indirect transmission. Indirect can be vehicle borne. For example, the Aedes aegypti transfers the dengue virus. It acts as a vehicle, vector borne. For example, the Anopheles mosquito transmits the plasmodium. Airborne can also be included in direct, and then formit-borne, which includes the sharing of items such as towel, kajal, surma between person who are infected, and it results in spread of disease like trachoma, unclean hands. Then susceptible host. The susceptible parasitism requires that there is a susceptible host. So the incubation period happens inside the host. Incubation period is the time interval between invasion by infectious agent and appearance of first sign and symptom. What is median incubation period? Time period required for 50% of cases to occur following exposure. Factors determine the incubation period include time of particular pathogen infective dose, portal of entry, and individual susceptibility. Infectious diseases are not communicable during incubation period, but there are some exceptions. For example, measles, whooping cough, or chickenpox, which are transmissible even during incubation period. The length of incubation period is characteristic of each disease. In some incubation period, it is very short, ranging from few hours to 2 days. Uh, Staphylococcus, food poisoning, cholera, bacillary dysentery, and influenza. Median length incubation period 10 days to 3 weeks in typhoid, chickenpox, measles, and mumps. Long incubation period is reported in hepatitis, rabies, and leprosy. Latent period is used in non-infectious diseases such as cancer or heart diseases, which take us a long period of time from disease initiation and disease detection. Then why is incubation period important? It is important for epidemiological studies. It is important for tracing the source of infection. In cases of diseases with short incubation period, it is simple to trace the source of infection and follow the trail of or the route of a spread of infection, as in food poisoning, bacillary dysentery, typhoid fever. Once source of infection is traced, it is possible to start appropriate control measures. The period of surveillance helps in determining period of surveillance, which is advised. It is equal to maximum incubation period of disease. Then immunization. Immunization is prophylactically knowledge of incubation, and it helps us to prevent clinical illness by immunizing by boosting immunity of particular person. Identification of point source. All the cases occur within one incubation period of disease. Prognosis of disease. Incubation period can also be used in estimating prognosis of disease. In some diseases, shortened incubation period results in worse prognosis like tetanus and rabies. Okay, so serial interval. Serial interval is the gap in time between onset of primary case and secondary case. The primary case is followed by 2 or 3 secondary cases within a short time period in a small group. Communicable period. Any illness due to specific infectious agent for its toxic products capable of being directly or indirectly transmitted from man to man, animal to animal, or from the environment. Then there are control measures for infectious and communicable diseases, which are measures for epidemiological investigation, which include reservoir or source of infection, route of transmission, and susceptible host. So controlling the reservoir is very important, which is the first link in chain of causation. It is deemed to the weakest link. Logically, the most desirable control measure would be to eliminate the reservoir or source if it is possible. It is relatively easy in the animal reservoir like bovine TB, but not possible in humans, in whom the general measure of reservoir control comprise early diagnosis, notification, isolation, treatment, quarantine, surveillance, and disinfection. These are all directed to reduce the quantity of agent available for dissemination. Then early diagnosis is very important in control of communicable diseases. Notification is important source of epidemiological information. It enables early detection of disease outbreaks, which permits immediate action to be taken by health authority to control their spread. Notification of infectious diseases made by attending physician or head of family, but anyone, including the layman, can report even on suspicion. The diagnosis is verified by local health authority. So some diseases require to be notified. For example, Naegleria needs to be notified to the relevant administration and authorities for proper control and chlorination of water. Then epidemiological investigation is called for whenever there is disease outbreak, which covers the identification of source of infection or factors influencing its spread, which includes geographical, situation, climatic conditions, social, cultural, and behavioral patterns, and the character of the agent, reservoir, vectors, and susceptible host population. Then isolation, which is the oldest communicable disease control measure. It is defined as separation for a period of communicability of infected person or animal from other in such places to prevent or limit the direct or indirect transmission from infectious agent who may spread the agent to others. In general, infections from human animal sources can be controlled by physical isolation of cases and necessary treatment until free from infection. Treatment. Many communicable diseases have been tamed by effective drugs. The object of treatment is to kill the infectious agent when it is still in the reservoir before it is disseminated. Treatment reduces the communicability of disease and cuts short the duration of illness and prevents development of secondary cases. In some disease, early diagnosis and treatment is of primary importance in interruption and transmission. Then quarantine. Quarantine is defined as limitation of freedom of movement of such wild person or domestic animals exposed to communicable disease for a period of time not longer than the longest usual incubation period will be. So these are applied. These are applied by health authority to persons who are coming from other countries through aircraft, road vehicles to prevent the spread of disease or reservoirs of disease or vectors of disease. In contrast to isolation, quarantine applies to restrictions on healthy contacts of infectious disease. Quarantine was once popular, but it has now declined in popularity. With better techniques of diagnosis, quarantine in is its use has been limited. Then interruption of transmission, which is a major aspect of communicable disease control, which relates to breaking the chain of transmission, which means changing some component of man environment to prevent infectious agent from patient carrier from entering the body of susceptible host. For example, water can be a medium of diseases like dysentery, hepatitis A, cholera, and the treatment of water will eliminate these diseases. Depending upon the level of population, this may vary from simple chlorination to complex treatment. The susceptible host, the third chain link in the chain, is the susceptible host. It may be protected by active immunization, which is one of the most powerful and cost-effective weapons of modern medicine. So what is active immunization? In which it can be done by introducing the killed pathogen or by providing vaccines which contain live attenuated organisms which induce antibody formation, or it can also develop from the course of disease progression in which the human produce antibodies after ingestion, after provision of vaccines, in which the human body produces its own antibodies. So it is relatively long term. And what is passive immunization, which is a short term expedient useful only to when exposure has occurred, in which preformed antibodies are given. So normally both active and passive immunization are recommended. Then we have chemoprophylaxis, which includes the protection or prevention of diseases. For example, tetracyclines are provided for cholera. Erythromycin are provided for diphtheria. Tetracycline are provided for plague. Sulfadiazine is provided and immunization for meningococcal meningitis. Then non-specific measures, improvement in quality of life, better housing, water supply, sanitation fall into this category. Then screening. Screening is basically search for an unrecognized disease or defect by means of rapidly applied test, examination, or other procedures in apparently healthy individuals. And these are especially for those population or individuals who are not seeking healthcare. Thank you. That's all.